Hello, I'm Dr. Bauer with Let's Talk Kids Health. I'm so glad that you were able to join me for today's quick chat. Today I wanted to tackle the question of when is the right time for medicine treatment for ADHD. Now, I get this question a lot. I have this conversation every week when I see patients in my private practice. It's a common question, and I thought I'd try to answer some of those concerns with this video. So as you know, I've talked about ADHD being a brain-based disorder. And as such, I think a lot of times after parents and families receive that diagnosis, the first thing that comes to mind is, oh my gosh, what next? Does that mean my child has to be on medication? And I do want to tell you that this is an individual decision that needs to be discussed with your child's physician. Treatment for ADHD needs to be tailored based on what the child is needing and meeting the child where they are, especially depending on their age, the academic demands, and how they're currently functioning at home and school. So after the original diagnosis, it's going to be really important to really think about the treatment plan or the care plan with your child's provider. Now, what does that mean? Yes, medication can be a part of that, and that's one part of the treatment plan. However, the other elements, which I'll just mention briefly, include self-care. So what are those healthy habits that we can begin to help children start doing in order to optimize brain and body health, including proper sleep, proper nutrition, and proper physical activity. The other part is behavioral therapy. What are the skills that children need to begin to learn to begin to organize, interact with peers, be able to communicate with you, be able to manage their emotions, and begin to be able to understand how to work with their ADHD rather than against it. And then the other part is parent training. What are some of the things that we as parents need to know about ADHD so that we can set up the environment for children to thrive? And also how to help navigate those moments that you're going to face where it's going to be stressful and challenging because your child's executive functioning skills are either lacking or lagging at that moment. So how can you make the most of that teachable moment to help guide your child through that so that you can get to the other side, right? And then also, along with that is school accommodations. So what are the things that are necessary in the school environment so that the child can function at the school, in the classroom, with their peers, and do what they need to do to learn? So those are the 5 different elements, and we have an ongoing discussion about that every year because as the child progresses and matures, demands increase, academic load, and it's going to be really important to help identify where the child's strengths are and where are their ongoing challenges so that we can come together and rally and support them. Right? Because in the end, we want our children to function well and to be able to be a productive citizen in the society while still being happy, right? So getting back to medication, I'm here to tell you that there is not necessarily a right time to start medication. Okay? So we know that medications can work. There have been a lot of studies on stimulant medications, which are the first-line treatment for ADHD. In fact, they were first discovered back in the 1930s for its utility in helping to decrease the fidgetiness, the hyperactivity, and impulsivity in children. But we do have a lot of randomized trials that were conducted over the years. And the most famous one is the multimodal treatment of ADHD study, which was conducted with nearly 600 kids. And what this meant was that they were randomized into 4 different treatment groups. And what they were trying to accomplish is to see what the optimal combinations of treatment were for kids with ADHD to make sure to optimize outcomes for them. And prior to this study that was conducted by the National Institutes of Mental Health, there were other previous trials that were, short-term in nature, following kids up to about 3 months. So the MTA study actually followed children longer term for up to 14 months and continued follow-up trials and study data are continuing to be published, but not to the same rigorous standards beyond that 14 months. But it still gave us a lot of good information. And we know that of the just under 300 kids that just got medicine only, we know that 80% of those kids actually had a significant reduction in the core symptoms of ADHD, meaning that they were not as impulsive, they were not as hyper, they were able to attend and focus and do what they needed to do at home and school. 4% of those kids did have severe enough side effects that they opted to stop. But I'm here to tell you that with a carefully crafted treatment plan, and we're focusing on this video on medication, needing to come to that discussion to your child's physician, prepared with your questions, your concerns, and just to gather information. So that way you can become clear if and when the time is right to start medication, you can feel better about it, right? I know that ultimately, sometimes when parents decide to start medication, they oftentimes will second guess or question whether or not they made the right decision. And, I think that happens. But it's a fluid discussion that needs to take into account at any point in time how your child is faring. Because ultimately, anything that we do for your child when we're crafting this treatment plan needs to be moving the needle in the right direction. So we're not going to just necessarily prescribe medicine to prescribe medicine. I often will tell parents to consider a couple things when they're thinking about medicine. The first is, how do they feel about medicine? Do they know somebody that's been on medicine for ADHD? Maybe they've had it as a child and tried it and didn't like it. What was their personal experience, or what is their knowledge of others who have had it that, you can't stop but think about what you've heard from other people that you trust, as well as what you've read on the internet. So it's really important to kind of get clear on your own personal thought about it so that you can ask questions to your child's physician. Secondly, you also want to think about your child's functioning. What that means is, how are they doing day to day at home and school? Because ultimately, again, I said, we as parents want our kids to be happy and to thrive and to be learning and doing everything that kids should be doing, and just to be able to get through life without getting hurt, without getting hits to their self-esteem, right? We want them to be thriving. And we know that sometimes, because ADHD is a brain-based condition, these kids often are lagging in executive functioning skills that they need to use day to day to be able to do what they need to do to learn, to be able to remember to bring home those papers or their folder to get homework done, to be able to retain information that they're learning day to day, to be able to make good choices either with peers or at home. And, again, sometimes it's just that need to slow down and to be able to take into account and to shift their focus and attention, to be able to take in the world around them, right? And so, thinking about how your child is functioning and being honest about how difficult it is, how challenging it is, and then thinking about the last part is what has already been tried. Right? Because, sometimes when I see families and, they're brand new to this, nothing really has been done yet, then, sometimes the choice is very clear in those cases. We absolutely need to focus on behavioral therapy and parenting support. There are only going to be a couple times, at least in my professional opinion, where we need to have a deeper discussion about medication sooner. One is if the child's behaviors of hyperactivity and impulsivity are so frequent and so severe that they're going to run out into the street. They have climbed and fallen. They're very impulsive and have anger, and they're aggressive in school, making wrong choices to the point where, they can't stay in school. Right. Those are instances where we have that discussion sooner because we know that stimulants can work to improve and reduce the frequency and severity of these types of symptoms, to be able to keep that child in school, to be able to keep that child safe. Because unfortunately, it only takes once for a child to dart across the street and not look both ways, and something terrible happen. So that's one instance. The second instance is a little bit more subtle, but it's still important to consider, is when kids have an impact on their self-esteem, right? These kids are struggling sometimes to be able to organize, prioritize, to manage their emotions, to make good choices when they're with peers. And oftentimes what happens is that they're hearing no a lot. Why did you do that? They're not getting the grades. And they begin to believe that something is wrong or they're not good enough, right? And they start comparing themselves to their peers or their siblings. And when kids have these hits to their self-confidence and self-esteem, it's not unsurmountable. But I think of it as a way medicines can help give that child a little bit better ability to focus and to really tune in and have some of those small wins that then feed upon itself, right? So as they are able to attend and to focus and to stop and think and make a good decision, then they get that feedback from the environment, their caregivers, their peers, and they're like, wow, this is great. I've never been able to do this before, and now I can. And just that little boost and that little win can be a snowball effect, right? So that coupled with behavioral therapy, that coupled with parenting support, can be just the little bit of momentum needed to get your child on the right path. So I do want to say medicine is not the be-all, end-all. It's never like a magic bullet. It doesn't teach your child anything. It does help reduce core symptoms, and it does increase the availability of dopamine and norepinephrine, those neurotransmitters that are shown to be deficient or less in children with ADHD. And it helps make sure that there's enough there because it's the two neurotransmitters that are responsible for regulating attention, focus, and all of that. So it just helps level the playing field for these children. And so I hope that was helpful. You know, these are some considerations, and obviously there are others too. So remember to always talk to your child's pediatrician about your questions, concerns, and to really think through this decision with your child, with your doctor, and with everybody on the team. And you're going to have those ongoing conversations along the way because things are going to change. But the most important thing is just to keep your eye on how your child is faring and how they're doing. I hope you found that helpful.